Okay, good noontime, everyone. Thank you for joining us. On behalf of the Maryland Department of Health, Office of Children and Youth with Specific Healthcare Needs, we want to welcome you to our second session in our Extra Services for Extraordinary People series. Today, we're going to dive into the home and community-based services that are operated by the Developmental Disabilities Administration. We are so honored today to have Rhonda Workman, the Director of Federal Programs and Integrity at the Maryland Department of Health, Developmental Disabilities Administration, or DDA, here to talk about these programs. She has served at the Developmental Disabilities Administration with the executive management team and has 30 plus years of experience developing and directing home and community-based programs, as well as assessing, analyzing, and providing technical expertise related to Medicaid waivers and state plan services, federal administrations, and long-term services and supports, rebalancing policies, operations, and services. Within the Developmental Disabilities Administration, she is responsible for federal programs including the 3DDA-operated Medicaid programs, which include the Community Pathways Waiver, Family Supports and Community Supports Waivers, their eligibility and policy. Rhonda has a Bachelor of Arts in Psychology from California State University, Sacramento, and she is an active member of her community, both leading and participating in various community activities and fundraisers. Thank you so much again for joining us, and we are recording today's session for those who couldn't make it today. And thank you so much, Rhonda.
Thank you. Really appreciate the opportunity to be with everybody today and share some information about our administration and the supports that we provide. Next slide, please. So here's an overview of what we're going to talk about today. I'm going to talk a little bit about DDA and give you an overview of who we are and what we do. We'll touch base on the difference between eligibility and entitlement. We'll talk about our process for people applying for DDA services. We'll also talk about person-centered processes, DDA services, our two service delivery models, and then we'll answer some questions at the end. Next slide, please. Okay, we're going to start with our overview, but let's go to the next one. Thank you. So we believe that all people have the right to live, love, work, learn, play, and pursue their life aspirations in the community. We partner with people with developmental disabilities and their families to provide supports and resources to live fulfilling lives. We provide a coordinated service delivery system to enable children and adults with intellectual and developmental disabilities and their families to work towards self-determination, interdependence, productivity, integrity, and inclusion in all facets of community life across their lifespan. We are only one of many resources, services, and supports that are available to assist individuals and families as they build their lives towards their vision of the good life. So we're happy today to share some information. Next slide, please. This slide is just to emphasize that we do support all ages. Sometimes people tend to think that we focus our services just on adults, but we do support the lifespan. So children, adults, and we also provide support specifically for our families who are very instrumental in the supports that they provide for their loved ones. Next slide, please. Now we're going to talk a little bit about eligibility and entitlement. You can go to the next slide, please. So in Maryland, a student with a disability who is receiving special education services is entitled to a free, appropriate public education through the school year in which the student turns 21 years of age. This is through the Individuals with Disabilities Education Act, or IDEA, of 2004. Or if the person has met the requirements of a Maryland high school diploma or Maryland high school certificate or program completion. So that's an entitlement through the school system. Next slide, please. Once a student exits the school system, they must meet eligibility criteria and funding availability to attend post-secondary education or receive services from adult service agencies. The DDA services are provided based upon eligibility for services and the availability of funding. So it's not an entitlement. Next slide, please. People with developmental disabilities may be eligible for a variety of different programs and resources. I know through this series, you're going to be hearing some information about the autism waiver and the model waiver, but there's also other programs that Medicaid provides and supports in addition to some other departments. That includes the early childhood intervention services, the infant and toddler program, family services, Medicaid's Community First Choice. In addition to the Department of Human Services, they have a respite care program. And actually, the Maryland Department of Disabilities also has a program referred to as the Attendant Care Program. So that you can see there's a variety of different services and supports and programs in the state of Maryland in various departments and also within Medicaid that provide services and supports to people with intellectual and developmental disabilities. Next slide, please. In addition to the Medicaid home and community-based waiver services we're going to talk about today, also wanted to share with you that the DDA also administers a program called the Low Intensity Support Services, or LISS. This program is available to Maryland residents with a developmental disability. There's a variety of types of services and supports that people can use the funding for, such as assistive technology, respite, childcare, equipment, and such. And what we do is twice a year, we have a random selection process where people can submit an application. The first round is May to June. The second round is July to October. And if selected, then the person, if they meet the eligibility, have the opportunity to receive funding up to $2,000 to meet their need. We've included a link on the slide here for more information that's also on the DDA website. Next slide, please. So now I want to start to talk about people applying for our full DDA funding, ongoing funding resources. Next slide, please. So our services are usually paid for by Medicaid through one of the DDA operated Medicaid waiver programs. You heard in the first series, Jamie talk about Medicaid waiver programs. DDA services are provided based upon eligibility for services and the availability of funding, as I recently mentioned. Next slide, please. So there's really two important things to think about in terms of our process. We actually have two important application processes that must be completed in order for people to be determined fully eligible to receive the funding. The first process is the DDA eligibility application. And the second one is the DDA operated Medicaid waiver application process. So we'll touch base on both of these. Next slide, please. For the DDA application process, the DDA accepts applications of any age at any time of the person's lifespan. Eligibility for services does not mean that the DDA is able to provide funding to address everyone's needs. It means that when designated funding for a priority category is available, we're able to offer the person with the greatest need to apply to the DDA operated waiver program. We have case managers that we refer to as coordinators of community services, where we will inform them about the opportunity to apply, and then they help the person with the application and exploration of services and provider options. Next slide, please. In order for the DDA to determine whether a person is eligible for DDA services, the person or someone acting on their behalf must first complete the DDA eligibility application. The DDA's application for eligibility can be downloaded from the DDA website, can be mailed to a person, or it can be picked up from one of our DDA 4 regional offices located in Central, Eastern, Southern, and Western Maryland. We've included links on this slide to the DDA eligibility application that's in English and in Spanish. Next slide, please. Once we've received, once the DDA has been contacted or has received an application and any supporting documentation, the DDA or our representative, typically that coordinator of community services, will contact the person to schedule an interview. After completing the application process, applicants receive a determination letter, and that will state their eligibility category. If eligible, the determination letter will also include information on which priority category the person has been found eligible for. Next slide, please. So let's talk a little bit about those eligibility categories. Next slide. As per Maryland law, we have two eligibility categories. The first one is developmentally disabled. We refer to this as DD eligible. The second one is supports only, or SO eligible. And then people who do not meet either of these standards would then be found not eligible. Next slide, please. So let's talk a little bit about the developmentally disabled, or DD category. Individuals with a developmental disability diagnosis are not necessarily eligible for services under the DDA. Eligibility is not based on category or name of disability. The person needs to meet all specific criteria established in Maryland law, hence the importance of functional assessments that we use. Next slide, please. This slide outlines the 5 criteria outlined in Maryland law for which a person must need to meet in order to be determined developmentally disabled or DD eligible. The criteria includes that the disability is attributed to a physical or mental impairment other than the sole diagnosis of mental illness or to a combination of mental and physical impairments. The disability must be manifested before the individual becomes 22 years old. The disability is likely to continue indefinitely, and it results in an inability for the person to live independently without external supports or continuing or regular assistance. And it reflects the need for a combination and sequence of special, interdisciplinary, or generic care, treatment, or other services that are individually planned and coordinated for the person. So again, for this eligibility category, the person needs to meet all 5 of these criteria. Next slide, please. Our supports only eligibility category only includes 2 of those standards that we just talked about. So the severe chronic disability that is attributed to a physical or mental impairment other than the sole diagnosis, and it's likely to continue indefinitely. So those are the 2 eligibility categories that the DDA has. Next slide, please. Now we're going to talk about priority categories. Next slide. The DDA in our regulations and statutes outlines 3 priority categories. Crisis resolution. The person is in crisis or in an emergency situation today. Examples are the person could be in an abuse situation, neglect, homelessness. The second category is crisis prevention. The person is or will be in a health or safety crisis within the next year. And the third category is current requests. In this category, the person needs or wants services, and health and safety are not the immediate issue. For example, maybe they're interested in a job, or maybe they need some assistive technology. Next slide, please. So we've talked about our eligibility categories and our priority categories. Now we're going to talk a little bit about our determinations and notices. Next slide, please. Our determinations and notices would include a letter to the person letting them know that they're eligible for full DD services funding or supports only. The person would receive an approval letter with their priority status and placed on the DDA waiting list. Or the letter of determination could be that the person is not eligible for either full DD services or supports only. We would send a denial letter and also include our appeal rights. Next slide, please. If the person feels that they have not been placed in the proper eligibility or priority category, or if they were determined not eligible, the letter will also contain information to help the person with a request for reconsideration, where they can send in additional information for us to consider and change the determination. They can request a case resolution conference where an independent person would mediate and consider both sides of the case. And they have the opportunity to request a Medicaid fair hearing, where they would go before an administrative law judge to state their case. Individuals have all 3 of these options and can exercise all of them. It's really important that we share with everybody for applicants to keep the DDA updated of any changes in their circumstances and contact information so that we're aware of that. At times, people may be determined current requests, but their situations may change. With new information, we can change their priority category to crisis prevention or crisis resolution. Next slide, please. This is a visual of our process. And basically, as we've talked about, the person reaches out to us, they can submit an application. We assign a case manager, that coordinator of community services. That coordinator of community services performs a face-to-face assessment with the person. They provide the regional office with a report and supporting documentation. Our regional offices reviews the application packet. If needed, we can consult with an expert if we're having challenges to make a determination. The regional office then makes the final determination, and then we give the person the notice that includes the rights for reconsideration, case resolution conference, and Medicaid ferrying. Next slide, please. This is a slide that's got information about our regional offices and our eligibility and intake. So that's available for you to, if you want to refer anybody to our regions for eligibility determinations. Next slide, please. So now let's kind of pivot to the DDA operated Medicaid waiver programs. Next slide. So when the DDA has funding for people on our waiting list or a priority category that the waiver application has, the next step would be the application for the DDA waiver program. We do have a variety of priority categories noted in our programs. So these are basically places that we set aside for people in certain situations so that they can immediately apply for services under the waiver. That includes emergency situations, court-involved people, people leaving an institution, youth exiting the foster care system, people on the DDA waiting list, and transitioning youth exiting the school system. For these categories and the other categories noted in our waiver program, each of them have specific criteria that would need to be met before we be able to provide that opportunity to apply. Next slide, please. So a little bit about Medicaid waiver programs. Next slide. So a Medicaid waiver program is a federal medical assistance, also known as Medicaid program. Waiver means that some of the regular Medicaid rules are waived. That is, they're not applied. And waivers are typically intended to give states flexibility to serve specific populations and provide services in really innovative ways. And it's important to note it's not a grant. Next slide, please. So what are some of the eligibility requirements? Jamie touched on this a little bit in the first session, but individuals participating in Medicaid waiver programs must initially and continuously meet the eligibility criteria. That includes technical eligibility, which is based on the program. It includes things like age requirements. It could be diagnosis, making sure that there's a plan that meets the person's health and safety needs. Medical eligibility, again, based on the program. It could be a nursing facility level of care, a chronic hospital. For the DDA operated programs, we utilize the intermediate care facility for individuals with intellectual disabilities. And then there's financial eligibility, which is based on income and assets of the individual, not the family. Next slide, please. This is just a slide that kind of notes the various home and community-based waiver programs that we share when we're doing presentations. Today, we'll be focusing on the DDA operated programs. Next slide, please. Okay, so let's talk about those DDA operated programs. Next slide. So the Developmental Disabilities Administration administers on behalf of Medicaid, on behalf of Jamie's office, 3 home and community-based waiver programs. Our Family Supports Waiver is designed to support children from birth to 21 years old and includes various support services that we'll touch base on. Our Community Supports Waiver supports adults 18 years and older. It includes the same support services from our Family Supports Waiver, but we also have the ability to provide services that we refer to as Meaningful Day, and we'll talk about them today. Our Community Pathways Waiver is the oldest Maryland home and community-based waiver program, and it supports adults 18 years of age and older. It includes the same support services as the other 2 programs. It includes the same Meaningful Day services from the community supports, but we've also added our residential services. And so the Community Pathways Waiver is considered a comprehensive waiver in the sense that it can provide 24/7 services for people. Next slide, please. This again is just demonstrating to be eligible. People need to meet priority categories or be on our waiting list. and a top priority with slots available in our program. And our coordinator of community services helps to facilitate the person with the DDA waiver application packet. The packet was shown on the next slide. So let's go to the next slide. So the DDA waiver application includes various components that we complete. It includes that Medicaid waiver application. So it's specifically for the waiver program that the person's applying for. It includes a person-centered plan that we'll touch base on. It includes a form that helps to certify that that person meets the medical eligibility. We refer to that as a level care form. It includes another form related to freedom of choice. And under Medicaid home and community-based waiver programs, people have the choice, if they're eligible, to receive their services in the community or to receive their services in an institution. So with this form, they would indicate their preference. We also have another form we refer to as EDD release form, which is a form that allows the case manager to also be included in information and requests for information related to financial eligibility. And also it includes other supporting documents related to the person's needs. Next slide, please. So to kind of pull this all together, we've talked about the DDA application. So I could apply to DDA for services. I complete that application. Then the coordinator of community services meets with me. They do a comprehensive assessment, pull together information that they're going to give to the DDA eligibility determination unit. From that perspective, the CCS, if we're determined eligible for DDA services, then I would receive a letter letting me know that I have the opportunity to select a case management agency, and I have that through a choice form. I would be placed on a waiting list if I was found to be DD eligible. And then if I met one of those priority categories that are noted in the waiver application, I could be offered the opportunity to apply to a waiver program. So that's where the waive placement or funding authorization comes into play. The yellow box is the waiver application packet that we just talked about briefly. Once that's submitted to DDA, we review the information, and if the person meets all the federal requirements of the waiver program, we can authorize the person to participate or enroll in the program. There's a separate unit within our department called the Eligibility Determination Division that would complete an overall decision for that. And then the person is fully enrolled in the waiver and they can start services. So this is just a nice process flow to show how people move through our system. Next slide, please. So one of the key components of our waiver application is the person-centered planning. And so we utilize different foundation and planning tools that we'd like to share with you today. Next slide, please. So the importance of planning is really important because it helps the person think about what is important in their lives now, and also to think about what would make sense for a good future. And based on the person's choices and goals, various life areas, or what we refer to as domains, can be explored. They include employment, day-to-day, community involvement, communication, finances, health and wellness, home and housing, lifelong learning, relationships. So these are different areas that people can explore with their case manager and team as they develop their person-centered plan. Next slide, please. So our process in developing a person-centered plan, we first start with our person-centered planning tools, and we'll talk about a few of those in a minute. Our plans within our system also includes what we call focus area exploration. And those were the different categories we were just talking about. So if I'm interested in a job, I would want to look at employment. If I was looking at, I needed some supports in my day-to-day, I would be looking at those opportunities. All that information helps to feed and develop what we call our person-centered plan. It includes a summary of information related to the person, specific outcomes and goals that they want to achieve, and also the service authorization related to the waiver services. Next slide, please. So related to those planning tools, there are several national planning tools that have been developed and are used across the nation, specifically related to people in HCBS programs. We do not mandate a specific planning tool, but we highly encourage teams to consider and offer training for all our stakeholders related to these planning tools. Individuals facilitating a specific planning strategy should be trained on those specific planning tools. We'll talk a little bit of those. Next slide, please. So one that we talk about often relates to charting the life course, and we talk about an integrated STAR tool that is available. We know that all people need support to lead good lives, including myself. Using a combination of many different kinds of supports helps the person to develop their trajectory towards their good life, towards an inclusive, quality community life. And so after exploration of generic, natural, community, local, and other resources, the person-centered team should determine if there's any remaining unmet support needs that can only be met through the waiver or Medicaid services. And so this tool helps individuals and families to brainstorm the supports that they already have or might need in order to work in partnership to make their vision of a good life possible. So as you can see, the team would explore the person's own personal strengths and assets, relationships they have. They would look at technology that they could use, community resources like libraries and parks and such, and then also look at eligibility specific supports. Those things could be like food stamps, Medicaid, Medicaid waiver programs, housing vouchers and such. So by looking at all these opportunities and resources, you can identify what's available and what unmet needs are there. Next slide, please. So let's now start to talk about what's available in the DDA programs. Next slide, please. So DDA and all Medicaid waiver programs have an application or a document that's approved by CMS. And so when we share information with people, we also let them know that within this document, there is different appendices, or what we refer to sometimes as chapters. And the main one that talks about all the services and has detailed information about the service description, service requirements, limitations, service delivery methods, and provider types and qualification is all noted within Appendix C. And so today we'll be sharing a general overview of some of the information and services, but if you're interested in more detail about the services that we're talking about, the requirements, types of providers that can provide that, any limitations, we would refer you to our waiver application that's been approved and looking at Appendix C. Next slide, please. So again, we just want to note that it's really important to keep focus on the person's goals and trajectory before people start jumping right into services, because we have to know really what that person's trajectory and their goal is to identify what kind of supports would best meet their needs. And we categorize the DDA waiver services into 3 buckets or categories. One is our meaningful day services, one is our support services, and the other is our residential services. And so all supports and services, not just DDA funded services, need to be considered, explored, and reflected in that person-centered plan. And the focus always should be to create a support for the good life versus what we sometimes refer to as a service life. So we don't want individuals that their life is filled with going to day programs and then going home to a residential program. We truly want them to be integrated in their community with their families and supported. For us, our waiver programs, we have over 40 services and supports. And so that's why we've broken them down into 3 different kind of buckets that we'll talk about next. Next slide, please. So our first category we like to talk about is our meaningful day services. And so these are available for people 18 and over. And meaningful day services provides the person with opportunities to have supports on their way to employment, to work in competitive integrative employment, and to develop skills and talents and participate in their community. So some of the services that we have available include our employment services that are meant to be very flexible, customized to help people in getting a job, maintaining their job, owning their own business. So our employment services, supported employment, employment discovery and customization are very similar, but they provide opportunities for us to do in review and analysis of a person's skills and interests, to help them to potentially create a job that would be customized to their skills and abilities and offer that to an employer, and to have that ongoing support on the job or as needed in terms of maybe follow along in terms of the jobs changing. We also have career exploration, which is meant to be a short time service for people to kind of do internships in a sense and explore some different types of jobs that would be in competitive integrated employment that they're looking for. Next slide, please. We also have some additional services. Community development services are specifically designed to help people to integrate and become part of their community. So it's to develop and maintain those skills so people feel very comfortable interacting and being a part of their community. We also have our legacy service called day habilitation, which builds skills and supports for people to participate in the community. These are done in small and large groups, and activities could be done at a provider-owned and licensed site, in addition to supports and activities in the community. And lastly is our medical daycare program, which provides health care related supports in a licensed site, including nursing, therapy, nutrition, personal care, social, and other related activities. So those are our meaningful day services. Next slide, please. We have a variety of support services that can support the person at home and in the community. There are many of them, and each is different in how they can help the person or the family or the caregiver. They include a variety of things like our assistive technology, respite, vehicle and environmental modifications, behavior supports, mentoring services, and more. So on this slide, you can see some of those, and on our next few slides, you'll see some additional ones. But great opportunities to support people in different areas, for technology, to behavior supports if they need a formalized behavior support plan. Our environmental assessments can be completed that can lead to environmental modifications to support people to be more independent in their home. We have some pretty unique services to support our families, to include family and peer mentoring supports, where family members can be paired with other family members and peers paired with peers. This includes siblings who are often in need of some mentorship too. And then we have our family caregiver training and empowerment services that provides an opportunity for family members to get additional training so that they can learn additional strategies to support their loved one. Next slide, please. Some additional support services includes our housing support services available for people 18 and older. It's time-limited supports to help people with some of that housing vouchers and creating a housing support plan, helping people to understand what it means to be a good tenant and paying rent and your recycling and all those great things that we have to do as renters or housing owners. And so this is a great support for people who want to become more independent. Our individual and family directed goods and services is a service that's available only under our self-directed option. It provides the opportunity to use some funding that's left over in ways to enhance the community and life. Our live-in caregiver supports provides an opportunity for someone to move into the home of the person and provide care in exchange for room, so free rent and some food allowances. We have nursing support services that are available that provides a registered nurse that provides consultation, case management, and delegation services. We do not provide direct private duty or skilled nursing services, so ours are just support services. We have a participant education, training, and advocacy support, similar to our family caregiver supports, but this one's designed specifically for participants and covers some opportunities for education, self-advocacy conferences, and things like that to help them with their skills and be able to articulate their needs and voice. We also have personal support services, which is available in the home and in the community, which also helps to develop independent living skills and supports the person in terms of their community interest and integration. Next slide, please. And the last group of support services includes our remote support services, which provides an opportunity for off-site assistance of support. So think of this in terms of someone who's living on their own. There could be some remote supports available, a computer or AT device where they can log in and reach out to someone if they needed assistance and have some check-ins from that. We also have our respite care services, which is available for providing temporary supports to give both the person and the primary caregiver a break from the daily routine and caregiving. Our support broker services is another service specifically for people self-directing. It's an optional service that can provide coaching and advice and mentoring related to the person self-directing. When you self-direct, you are the employer of record, and we'll talk a little bit about that. We also have transition services, which provides funding for people who are moving from an institution or a provider-run home to their own home. It can help with moving expenses. It can help with helping to get some initial furniture, towels, dishes, silverware, things like that. We also have transportation services, which helps people to get to and from their community. We've got a variety of options in here, including travel training, orientation training, and such. This service is designed to support people when they're moving around or getting from place to place independently. Some of our services that we talked about for Meaningful Day also include transportation. So if a staff person is with them, then that transportation would be covered under that primary service. And lastly, we have vehicle modification, which can cover the cost of modifying a person's vehicle so it can be more accessible for them and safe for them to be moving around. Next slide, please. And so last group of services are residential services. And so we have some different models here that we're going to share with you today. Our residential services includes a supported living option where we provide funding for supports to be provided to the person in their own home. It helps them to learn independent living skills. We have a shared living service that supports the person who may be joining another person or a couple or a family. So think of it kind of like a foster care arrangement, but they're basically people coming together and sharing living and life and becoming a unit. Then we have our 2 provider-owned and operated licensed sites. Our community living group home site supports people who are living in a group home, help them with daily living skills and such. They typically have roommates and such. And our community living enhanced supports is very similar to our group home supports, except it's specifically designed to provide extra supports in terms of behavioral supports and supervision for people who may have court orders, behavioral challenges, or some extraordinary needs. So those are classifications and examples of our services. Next slide, please. So within our waiver programs, we offer these various services that we talked about, but we also offer 2 service models that I want to kind of talk to you about a little bit. Next slide, please. Our services can be delivered under either our self-directed service model or our traditional service delivery model. And so for self-directed service delivery model, this is a model where the person hires individuals, vendors, and provider organizations that meet required qualifications, certifications, and licensing standards. Under the traditional service model, the person chooses from professionals and provider organizations that are licensed or certified by the Maryland Department of Health. Next slide, please. Under the self-directed model, this is a model that promotes personal choices and control over the delivery and service of the budget. The person or their designated representative has what we call employer and budget authority. With that, they are responsible as the employer of record. We have an entity that will support them in terms of actually filing and becoming an employer with the IRS, and they will be getting an employer identification number. Some of the employer authority responsibilities includes the person having all decision-making authority to recruit, hire, train, and supervise individuals who furnish their services, and also budget authority, which relates to decision-making over how the Medicaid funds in their budgets are spent. So under this model, that person-centered plan is created. It creates a budget allocation for which then the person is responsible for managing and overseeing. Under our traditional model, the services are provided by a DDA certified or DDA licensed community agency, and that provider assumes all responsibilities as the employer record. So they are the ones that are hiring, firing, and training and paying their staff. Next slide, please. So a couple of resources available here and on the DDA website. We created a guide to service for people with intellectual and developmental disabilities and families, and then also an easy to understand guide to service. These were developed in partnership with the DD Council and other key stakeholders so that we could provide information in an easy to understand, plain language way. Next slide, please. This is my contact information. And then we can go to the last slide, which is questions. So happy to answer any questions that you may have. So I can
There were
see
some questions in the chat. Did you want me to read them or were you?
Sure, if you want to read them, that's great.
There's a question about is future needs still a category that's used?
So that's a good question. Our waiting list includes the three categories: our crisis resolution, crisis prevention, and current request. Future needs refers to people who don't need services now or within the next 3 years. And so they're put on a separate list so that if anything changes, we would bring them over. So it's not part of our waiting list.
Okay, Tiffany says I do local PASRRS and discover many people in the community that have an intellectual disability diagnosed before age 22, but are not known to the DDA and do not have services for a variety of reasons, such as the client did not need services when they were younger since the family provided the care. The family never wanted services here for judgment back in the 50s and 60s. They moved from another state or a county or were not transferred or had no case management follow-up. What is the best way for them to apply for these waivers? What general papers do they need? Many families do not have the original diagnosis papers from the doctor, but Down syndrome is a childhood diagnosis and it is affecting them as they get older and need services as their primary caregiver is no longer around. Do they need a psychological evaluation? Where should I send families to get help? I generally tell them to call the Western Maryland DDA office.
Yeah, great. Great question. Thank you for sharing all that information. And so yes, you would definitely want to have people call the regional office. And we've got that slide that has the eligibility people there that you can contact for each of the region. We do find that there are still family members. Well, I would say in general, we know that family members are essential and critical and provide extraordinary support to loved ones. And as in this situation, we have individuals that have been with their family member their whole life and have never reached out to the state or other resources for services. And as you know, our family members become older. We have some people that are still in their 90s and such that are providing primary care. Sometimes they reach out to us and need support. And you're right that the eligibility process can be a little bit more challenging because some of the records that would originally document that a person had a disability prior to the age of 22 may not be readily available. And so what we will do, the regional offices would work with the individual and the coordinator would work with them to try to identify additional information through doctors or people known to them so that we can try to gather evidence and information so that we can make that determination that the person does meet those 5 criteria. But absolutely, the first step would be reaching out to the regional office. And again, we support people of all ages. So as you're interacting with different people and you think that maybe they could benefit from our services and supports, please share our information. We'd love to work with them, make a determination. And if they don't need services immediately, they may need something in the future. We have a number of people that are supported through different service systems or the school system that are having their needs met now, but things could change, and having them being known to us, we can help to support them and change priority categories, or when they're ready to transition, maybe as a youth exiting the school system, or older people who maybe are moving on from their family members. So yes, that's great.
Thank you so much, Rhonda. Danielle asks, can teens age 16 who already have DDA approved funded get residential services, or is it that just when they turn 18, group home, etc.? It's incredibly difficult to get sufficient DDA in-home 8 hours in PG County for kids, let alone the rest of it.
Yeah, great question. Our residential services are for people 18 and older. So teens, we would not be providing residential supports. I think if you're having challenges with getting in-home aid supports, you can reach out to the regional office. They can help to try to support the person in the team in terms of exploring other providers. There is challenges with staffing and resources, I think, nationwide related to supports since the pandemic. But if you're encountering or supporting an individual in unique situations or challenging situations, please reach out to our regional office. We're here to help and support and help to identify additional resources if we can.
And we do have time, so if you have a question, you can either put it into the chat, or if you sort of raise your hand, I can unmute, give you mic privileges. So we'll hang a minute to make sure we answer any questions.
So I know it was a lot of information, right? So we talked about a variety of things.
Danielle says, thanks, we are in crisis mode post-hospital, and I've asked the regional office contact, but I am just being told that this is all out there. I'm just being told that this is all out there now.
Okay, but feel free to reach out to the regional office or contact me. I'm happy to, support you any way we can. My email is Rhonda, RHONDA .workman, WORKMAN @maryland.gov. There it is. Thank you, Bailey.
And yes, just to make sure everyone knows that the slides and recording will be available after the session. You'll have to give us a few days to process, but it will be made available to everyone who attended and those who registered.
So as you're thinking maybe some additional questions, just to kind of recap, we support people of all ages, children through the end of life. We look at the life course and looking at how we could support their needs. We have a 2 application process. First, the person has to apply to DDA to be determined eligible for DDA funding under Maryland statute and law. That's where we have the 2 eligibility categories, developmentally disabled or supports only. When we get that application, we're going to look at information. We're going to try to research and get as much information as we can so that we can make that determination. Once we do that, we're going to send a letter to the person to let them know our findings, whether they're DD eligible or supports only. We'll also tell them the priority category that they've been placed on and on the waiting list. If they're DD eligible, they'll also be provided an opportunity to choose a case management agency that can support them while they're on the waiting list and look at other resources and options available. If they meet a criteria for one of the DDA operated waiver programs priority categories, maybe they're emergency, maybe they're transitioning youth, maybe they're court involved, we then provide the opportunity to apply to the DDA operated waiver program based on the slots and funding. The coordinator will assist them through that process. And if they're found eligible to meet the technical, medical, and financial eligibility, then they're enrolled in the program. And then they can select from the 2 service models, right? They can self-direct or they can choose the traditional model. And then based on that person-centered planning process, looking at what their goals and their outcomes are, identifying other resources, relationships, technology, community services, that will help to identify any unmet need. And then that's where exploration of the DDA services, whether it's employment, support services, or residential services, could meet their needs.
Tiffany asks, is there a list of the diagnoses that DDA considers intellectual disability for services?
Yeah, just a reminder that we shared earlier, we do not determine disability based on diagnosis. So we don't have a list of diagnoses. We look at both functional and adaptive skills, and that's where having records, psychological, psychiatric assessments, i.e. Individual education plans and other documentation will help us because we're really looking at functional and adaptive skills based on those 5 criteria.
Thank you so much, Rhonda. This has been wonderful. I really appreciate you and being patient. Okay, so we have one more question that's come in. What are the 5 criteria?
Yep, that was on the slide. Remember, we talked about it cannot be a sole diagnosis of mental health or physical disability, can be a combination, needs to be prior to age 22, need coordination of information. It's not a short-term disability. So that was one of the slides where we noted all those.
And we will share the slides with everyone, so you'll have those written out for you.
Right. And then I see Jamie noted, our DDA and CFC program staff in contact with each other regarding services being provided to mutual individuals. Know someone who can access more than one program for supports, only one waiver specifically. Is there one program that would be better suited to individuals based on their needs? So it's a great question. It's really important to utilize that person-centered planning process. There are people that could be involved in multiple programs, but you can only be enrolled in one waiver program at a time. So Medicaid's Community First Choice program, a person who's enrolled in a DDA operated waiver program could be eligible for receiving services in addition to the rare and expensive case management program that's coming up in the series. And I think it's really important to look at the person's need and assess those needs to determine which program and services are best to meet their needs.
There's also a comment, and could you please give more detail on the support option
I'm not too sure what that means.
from Indy? Indy, if you want to either put more details in the chat or if you want to unmute yourself, I can give you that privilege.
And if you want to follow up, you could send me an email. Happy to connect with you. Okay, so supports only option, that's also in our slides. So I'm pulling up my slides here on the side related to that. So basically what we talked about today is in Maryland law and statute, there are 2 eligibility categories. One is developmentally disabled. We refer to that as DD eligible. The other one is supports only, or we refer to that as SO eligible. And so a couple of things to think about in terms of the difference of the categories is the standards that need to be met. So if you're developmentally disabled, if you're determined to meet that, there's 5 criteria. The first one is, again, you have a disability that's attributed to a physical or mental impairment, but cannot be a sole diagnosis of mental illness. The disability had to have been occurred before the person turned 22 years old. The disability is likely to continue indefinitely. It results in the inability to live independently without external supports or continuing or regular assistance. And it reflects the need for a combination and sequence of special, interdisciplinary, or generic care, treatment, or other services that are individually planned and coordinated for individuals. So there's 5 criteria to meet if you're developmentally disabled. Under our supports only, or what we call SO eligibility category, there are only 2 criteria to be met. The first one is that you have a disability attributed to a physical or mental impairment other than that sole diagnosis of mental illness, and that the disability is likely to continue indefinitely. It's important to note that for our waiver programs, which is the funding that we have that we provide our services through, the level of care that you would need to meet aligns with our developmentally disabled or DD eligibility. So if you're DD eligible, you would meet that level of care standard. If the person is determined supports only, they would not meet the Medicaid waiver level care standard. Hopefully that was helpful. Those are on slide 20 and 21. You're welcome.
Okay, I'm not seeing any further questions. Thank you so much again, Rhonda. We really appreciate you. And thank you all today for everyone who's joined us. Again, we will send out the recording and the slides after this session.
Great. Thank you.